Hello and welcome to 18 WJTS in.form. I'm your host, Bill Potter. We're going to talk about suicide prevention and helping loved ones in crisis. Joining us in the studio is Janet Schnell. Now, Janet is the president of the Survivors of Suicide
of Du
Bois County. Okay. And then also joining us is Kathy Milam. She is the Tri-County Out of the Darkness Walk Coordinator and a member of an organization we're going to talk about here shortly. Kathy, welcome to the show. Glad both of you are here. Let's first of all, I'm going to throw this at you, Janet. If you would, and sometimes they can be depressing, but I think we need to look at it. Give us some statistics that people may be surprised by.
Indiana has always been above since I've been tracking for over 26 years, has been above the national average for most of the years except 2 times. That's sad to know that here in Indiana that we really aren't doing a very good job in addressing suicide prevention, how to help lost survivors. What we do know is that for every suicide death, there are 135 people who are deeply affected. And of those 135, 6 people have life-altering experiences. People like me, that after my brother Kent died by suicide, it changed my life forever. I started college. And so that's what we're seeing when it comes to statistics, is that many people, they don't think that suicide affects them, but we're finding out more and more through research that a lot more people are affected. We just don't talk about it.
And that's some of it. We don't talk about it because at one time, wasn't Du Bois County, unfortunately, one of the leading areas for suicide?
Absolutely. That when we looked at per capita in the early 90s, Du Bois County had one of the highest suicide rates. Again, that's per capita. Now, we had a wonderful team that came together in Du Bois County to say, this is a problem, we need to address it. And so we had a wonderful group that came together and still comes together quarterly to talk about suicide prevention in our community and what is it that we need to do to help decrease those numbers. But still, one suicide death is still too many.
Right. Now, we're going to talk about a walk and ways that you can help shortly here, so just hang with us for a little bit. But we're going to ask Janet a couple more questions. Tell me about the suicide of survivors of suicide of Du Bois County. How long have you been around?
Wow, we've been in Du Bois County for over 26 years. It was after my brother Kent died by suicide. My family and I were really looking for support, people who understood us, other lost survivors. So we drove to Louisville, Kentucky, because it was the closest support group that we had that we were familiar with. So then we came back to Du Bois County and said, okay, we really need to have something here because, like I said, when we had one of the highest suicide rates per capita, we knew there were a lot of lost survivors who really needed to talk, to be able to identify with each other. And so we started in Du Bois County, and we started with our support group first. First, we had a licensed clinical social worker who actually led our group until we were able to train 3 lost survivors to actually learn how to facilitate a support group.
Now, are there evidence-based suicide prevention programs that you guys have available?
Yes. And so, again, going back through history, being here part of the United States, we found out very quickly that the former Surgeon General had asked for all the prevention programs actually to be an evidence-based training program. In other words, we want to make sure that if we're doing any kind of trainings, it really is effective and helpful. And so again, coming back from the group that we have that started here in Du Bois County, we brought in Dr. Paul Quinnett with QPR. It's an evidence-based program. And because of the program that we had here, I helped to develop the school evidence-based suicide prevention specialist training here, which is actually going throughout the United States now. That what we're finding is that when we have the specialists in the school system to teach suicide prevention to our students, to the staff members, that we actually see that those numbers decline. The suicide rate, the thoughts of suicide actually decline. So we have QPR. We also offer ASSIST training, which is a 2-day training program. I'll go back. QPR is a 1 to 2 hour training program, ASSIST training. And then we offer things like CALM training, which is an intervention type training. And then we also help to train others how to help in a support group. And so we work really well hand in hand with American Foundation for Suicide Prevention, who also offers the other evidence-based training programs that we're able to offer locally because of them.
Are these, and what you do, only available for Du Bois County through your group?
No, we go anywhere. We just actually came from Knox County and Vincennes.
Okay.
So anyone who reaches out and asks us for help, we're there to help. We also have a new team that I'm sorry, the team has been here for a while, but it's just been newly funded through the state of Indiana. It's called the LOST Team, the Local Outreach to Survivors of Suicide, where we actually have trained professionals and lost survivors who can go to the scene of a suspected suicide death. Now, with that said, we stay on the other side of the yellow tape. We're not in the investigation side of it. We're there to help the family members, the neighbors, the friends, people who show up at the scene to help them go through this grieving process and to help them know what's the next steps. And so that's a specialized team, again, that's being implemented in the state of Indiana.
Well, like you mentioned, that one suicide affects 135 people generally. So it's important that you do the work that you do. Now, it takes some money to do some of what you do, and so there's a walk that is coming up. That's how we kind of lead into that. And you may see this poster around town, Walk to Fight Suicide, and there is a QR code you can scan and get more information or to register a team. So look for this in store windows and out and about, and you'll get your chance to participate. But let's talk about the Out of the Darkness Walk, and here with us is the coordinator, and that is Kathy Milam. And Kathy, first of all, this is put on by the AFSP, which is what?
That is the American Foundation for Suicide Prevention.
Okay, and what do they do?
Well, the AFSP is a nonprofit group that, they operate on 4 core strategies, being they fund suicide prevention research, they advocate at the state and federal levels for legislation that affects mental health care. They might mandate, for example, mandating that health insurance cover mental health care, that school systems provide adequate training in suicide prevention and mental health care issues to students and employees, things like that. They provide local outreach programs for survivors of suicide loss, like Janet and I. And then they also provide education in the schools, communities, workplaces, what have you.
So you have this walk coming. First of all, I want to ask you a question about it's Tri-County, Indiana, is that, so I'm assuming 3, but tri means, right? Yes. 3 counties?
Let me back up a little bit. Last year we held our very first walk in St. Meinrad, and the reason being was because it was primarily where the 3 counties, Perry, Spencer, and Du Bois, come together. And we decided to move it to the Jasper River Walk this year, but we decided to keep the name so that it would be more recognizable. And you don't have to live in any of the 3 counties to participate. We're happy to have anyone that wants to come out and help support our loved ones in crisis.
If you could talk more about the walk that is coming up, the Walk to Fight Suicide, Out of the Darkness Walk. When is it? Where is it? How do you register? Who can register? What do we do?
Okay. Well, first of all, it's at the Jasper River Walk on Saturday, October 29th. We'll start registering at 9:30, and the walk itself will actually start at 10. It's going to be just under a mile long. So if anyone doesn't feel that they can quite walk that far, there's plenty of places where you can shortcut back. We're going to start at the gazebo. You can register online. We have a website. If you find one of the flyers with the QR code, you can register by scanning that. Registration is absolutely free. We, of course, we're hoping to raise money for all of the AFSP's programs, but we don't require a donation for you to participate. We're happy to have anyone there that wants to help support us. We have a lot of groups that are coming in, actually forming teams. Most of them are in honor of loved ones that they've lost. And sometimes what the people forming teams do is actually sort of make it a friendly competition to see who can raise the most funds. And anyone that does register and raises at least $150 gets a free t-shirt.
Okay, but you can walk for free just to support?
Yes.
Or if you got a group, or if you yourself wants to raise a big amount, that'd be great. And they need to pay that day? They need to bring the money that day? Is that how that works? Or
well, if
you kind of pledging it?
Well, if you register online, you can actually do it online.
Okay.
If you want to bring the money that day, there will be a place set up to do that.
Okay, so the idea is to raise money. Is that the only purpose of the walk?
No, actually, it's sort of a dual purpose. It's, to me, and I think a lot of other people feel the same way, it's sort of a comforting and healing time as well, because you're in the presence of a lot of other people who are actually walking the same path that you are. One of the things that we do is an honor bead ceremony where we hand out colored beads, and different colors represent different types of loss. I lost a child to suicide, so I wear white beads. I know as I walk through the crowd, when I see someone else wearing white beads, that they know what I'm going through. And that in itself is very comforting, because grief can be isolating because people don't know what to say to you sometimes. But grief from suicide brings a whole other dimension into it because people don't like to talk about it. So a lot of times, people that haven't gone through suicide, they'll just gloss over it or they won't talk about it. But when you're in the presence of someone that knows what you've experienced, it's comforting.
And so I guess you're raising funds. That's almost an aside. It might be more important that people are just getting together, but we still need to raise the funds.
Exactly.
Right. So these funds that are raised, do they go away out of this community or they stay here?
Well, in the process of donating, everything gets actually sent to the AFSP, but then the funds are available to come back into the community for ASFP-approved evidence-based programs.
So that was part of the assist training that we talked about earlier, that they actually help provide, because the materials for that training alone is quite expensive. And that this is how we can actually bring those funds back to the communities. When we provide the training, the people who are in the training don't have to pay for those materials.
And because of the work that you do, there are ways that you can outreach. If you yourself are thinking of suicide, or you suspect somebody you know is thinking of suicide, or you know somebody you know is thinking about it, there is help. What do you do?
So just in July, the federal government actually funded a 3-digit hotline number, 988. And you can call, and this is not only for suicide, this is for any kind of a crisis that you may be experiencing or you're worried about someone. So you get to talk to trained professionals using 988 24 hours, 7 days a week, to be able to ask them questions, to find out resources, find out help. Now, some people aren't so comfortable talking on the telephone, they would prefer to text. Same thing, texting number is 741-741, and that we can actually use that the texting hotline to be able to talk again to the trained professionals. But we also have help locally. Memorial Hospital, Life Springs also have a crisis number that you can call. And if you're worried about someone, or you're having thoughts of suicide yourself, call the crisis lines, because there's help. We have many trained professionals here in Du Bois County that we can help you immediately be able to help you decrease those thoughts. Because many times what we find out is through mental health care that those thoughts of suicide can actually diminish and eventually go away, because we have very competent mental health providers here in our county.
People probably are afraid to reach out or to ask questions. And thus, here's a number. Can you call anonymously when you call? Is that so? You're not really putting somebody on the spot. Maybe that's what that fear or that pride that people have a little bit.
Yeah, I think that people feel like if they say the word suicide, automatically they will have to go inpatient against their will, and that's not the way it is. We're really opening the door to be able to talk about depression and talking about thoughts of suicide, because we don't want to see anyone die. That's the ultimate. What we need to remember most: we do not want to see anyone die.
So you need to reach out if you can. Use the information that we are showing on the screen, and be a part. Come and talk to people at the Walk to Fight Suicide, Tri-County, Indiana, Out of the Darkness Walk, coming up at the Jasper River Walk on Saturday, October 29th. You can decide on the 28th to participate, but better you do it early. The registration is at 9:30. The walk and opening ceremony is at 10. About probably an hour's worth of time that you might be giving up participating in. So see if you can go out and raise some funds and be part of that. Thanks to both of you. Is there anything either of you would like to add?
I think one of the things we also need to think about is that we need to have sponsorship for the walk. That having sponsors to be a part of the walk helps us to raise awareness more. So if you're thinking about joining a team, think about maybe becoming a sponsor so that you can have your logo put on the shirt, But then it's raising awareness by partnering with each other to say suicide prevention matters. And here's our information to say, yes, this is important too.
And did I understand correctly, this is the second one?
Yes, it is.
Okay, so this is going to be the second annual, right? Because you plan to do this?
Yes.
Okay.
We definitely do.
All right. So we would like to thank Kathy Milam, who has been joining us. She is the coordinator for the Out of the Darkness Walk. Also joining us, Janet Schnell with the Survivors of Suicide Du Bois County organization. Thanks to both of you for being our guest. Thank you for watching 18 WJTS. We hope to see you at the Walk to Fight Suicide coming up October 29th.